Public health officials in York Region are investigating the fourth confirmed case of measles in Ontario since the start of the year, but this is the first time the source of the infection is unknown.
It's certainly a big deal. So this is a locally acquired case of measles, and it's not entirely clear where it came from, which basically tells us that there's other cases in the community.
The confirmed case in York Region, a man in his 30s who has not traveled recently or been in contact with anyone sick, making this case different than the others recently recorded in the province.
It is, really unfortunate and jarring to have a case that we don't know what the exposure was, but we're managing it in in as aggressive way as we can, and I don't expect there to be secondary cases.
3 other cases have been confirmed in Ontario this month, in Peel Region, Brant County, and Toronto. They all involved children who had recently traveled abroad, including one Toronto infant who was hospitalized 2 weeks ago. York Region's medical officer of health tells us this latest case was mild, as the man was vaccinated against measles.
Which, of course, as well means they're much less likely to transmit it on.
In Canada, 91% of the population is immunized against measles, but that falls short from what is required to protect the country. Health Canada says coverage rates as high as 95% are needed to eliminate the deadly virus.
This is such a contagious infection that it does find unvaccinated pockets or under-vaccinated pockets.
Infants typically receive their first dose of the measles vaccine at 12 months, but routine vaccinations took a dip during the pandemic.
I'm very concerned about what is happening. It's incredible to see that here in Canada we're having this problem right now. So you have to take your children, for the vaccines.
You'd think that problems like this would be somewhat better addressed by the infrastructure we have now, but, it's unfortunate to see.
The recent surge in cases prompting Ontario's Chief Medical Officer of Health to issue a memo to local public health agencies to be prepared for the continued importation of cases and potential outbreaks.
Now, Tina, these warnings come just under a week until March break here in Ontario. What are authorities saying about travel plans with measles cases on the rise like this?
Yes, Cynthia, the federal government and various local public agencies have issued warnings for people who are planning on traveling over the March break. This virus is now in every region of the globe, with Europe being hit particularly hard. There's more than 40,000 confirmed cases there. And globally, the World Health Organization says there was a 79% increase in cases last year compared to the year before. So Theresa Tam, Canada's Chief Public Health Officer, is strongly advising anyone who is traveling to have those 2 doses of the measles vaccine. If you are just back from traveling and concerned, symptoms you can look out for are a cough, runny nose, watery eyes. There's a very distinct red rash that might also appear. But Cynthia, it is important to note most people do recover fully from this virus, but it can pose serious complications and be deadly for vulnerable populations.